amniotic sac. This baby is 16 weeks. So am I going to do a crown rump length on a 16-week baby? No. Absolutely not. Okay? At 16 weeks, I'm going to do the protocol that is mandated by the AIUM. Okay?
16 weeks disability gestation sac?
Yeah, we shouldn't see a gestational sac. Well, by 16 weeks, the chorionic sac has fused with the amniotic sac. I should only see one sac. Okay? It's the amnion that protects the baby. When we say our water broke, the amnion has broken. The fluid that protects the baby has leaked out of my body. Okay? Okay. If my baby is anywhere except the fundus of my uterus, it's an ectopic. If it's in my lower uterine segment, it's still not considered an ectopic, but it's going to be a high risk. If it's in my cervix, they're going to do a hysterectomy on me. If it's in my cornua, they could do a hysterectomy on me. Okay? To save the mother's life.
So they take the baby out?
They don't take the baby out, they just take out everything. You'll never have another baby.
Oh.
Mm-hmm. Okay? Because you can bleed to death in those two areas. The cervix and the cornua. Where's the cornua? It's where the interstitial goes into the uterus. Okay? If it is in my fallopian tube, they're going to try methotrexate first, or they might have, if it's an emergent, then they're going to take out my tube. They're going to keep my ovary because they still want my body to produce those hormones. It's usually going to be in the adnexa, but I've even seen them above the fundus of the uterus. It's your job to find the ectopic. Now, if my gestational sac is midline in the endometrium, that's called a pseudo-gestational sac.
Which is that a fake?
It's a fake gestational sac. That's our sonographic sign for an ectopic. Okay? Because as the blastocyst inserts into the endometrium, it's not going to be in the center. It's going to be covered up with endometrium. Remember the tick? It's going to burrow down, and then you're going to have endometrium on this side and endometrium on this side as it's burrowing down. It's on its way to the arterial supply where the placenta will form. Okay, y'all remember the arterial supply? Uterine, artery, arcuate, radial, then what? Huh? Y'all remember? Yeah? It's straight and then spiral. Remember, it's hit the dead end, it goes. Okay, and it's the spiral arteries that we slough off every month. But now I'm pregnant, so I don't slough off those spiral arteries. So the blastocyst is going to burrow down into that endometrium. Okay? Okay, so if my placenta is covering the cervical canal, the internal os. That's called placenta previa. There's 3 different kinds. There's complete, there's marginal, and there's low-lying. Those are the 3 different kinds of placenta previa. Okay? As the baby gets older, yes.
I'm sorry, can you explain the placenta previa in the lower line of the interuterine?
Okay.
line?
So let's draw a picture. I'm a picture drawer. Okay. So here's my cervical canal, right? This is my amniotic sac. Okay. I'm already 16 weeks, so I have to do a full body. Okay? Normally, we want our placenta to be here, to be here, or to be here. That's where we want the placenta to be. Anterior, posterior, fundal. Okay? But sometimes it will be here. That's a complete previa. That's a complete. This is a marginal. Because it's touching the internal os, but it's not covering the internal os. This one, it's marginal. It's less than, I can't remember. I'm just gonna put 1.5 centimeters. Okay? This is marginal. It's close to, but it's not touching and it's not covering. So those are the different kinds of placenta previous.
Do you mean low line or marginal for the bottom?
Huh?
Is it low line or marginal for the bottom? We have 2 marginals.
Yes. Oh, this is low lying.
Yeah.
Thank you. Low lying. Okay?
More than 1.75.
Centimeters away from the internal os.
So are they all like
High risk.
dangerous?
Placenta previa is the #1 reason for bleeding in the 2nd and the 3rd trimester. These babies are going to be, especially the complete, they're gonna have to have a C-section. Because the birth canal is blocked. There's no way for the baby to come out. And you don't want the placenta to come out first. Okay? I don't know what they do for marginal and low line.
Mr. Funk, what's the difference between placenta previa and vasa previa?
Placenta previa is where you have placenta presenting. Presenting means what is coming out first. Vasa previa is when you have umbilical cord presenting, which is just as harmful because you don't want the umbilical cord to come out first. You know,
It's only the last one.
In this case, they do C-section also?
C-section. Okay, so that's why it's important. The very first picture that we take with OB ultrasound
It's a-
is a cervix. So just take one of your images. Get in the habit of taking that image with color, with and without color, and with and without measurements. Okay, because that's going to prove whether you have a vasa previa or not. Okay, vasa previa. As my baby gets older, and I'm doing my exam, and I'm supine, and my patient starts breathing funny. She looks kind of clammy.
You'll get the news.
She keeps swallowing. She doesn't feel good. Very quickly turn them on their left side. Don't turn them on their right side. Turn them on their left side because they're going to throw up. Okay? Let them recover. Go get them a wet cloth. Let them recover before you finish your exam. Okay? That's called aorta caval compression syndrome. It just means that the baby's laying on the IVC and blood can't get back up to the heart. Okay. On our OB ultrasounds, am I going to want a full bladder or an empty bladder? I'm doing a second and third trimester.
The clinic empty.
Huh?
I saw the clinic empty. He sent the patient to the bathroom first.
Okay. Second and third trimesters. I really need to go to the bathroom. Let me just take one picture and then I'll let you go to the bathroom. Because I could be, you think I'm fat, but I'm really 38 weeks pregnant. Okay? You can't tell by looking at a woman how pregnant she is. Well, some women you can. But fat women, you can't tell if they're pregnant or not. Go ahead and get your cervical picture and then let them get up and go to the bathroom. Okay? Now, if I've got a 38 late third trimester, it's going to be hard for them to hold their urine. Still, just go ahead and try to get that cervical picture because you have to have an empty bladder for a translabial. A translabial is where we put the transducer at the mouth of the vagina and we shoot down into the cervix. Okay? You need an empty bladder for that. So just quickly, it doesn't take much time. Well, sometimes it does. Just take your one shot and let them go to the bathroom. Get them undressed in. Yes.
I didn't understand the idea why we take the one picture of the cervix before they go to the bathroom.
Why?
Yeah.
Because you might have to use the water in the bladder to use for an acoustic window.
Ah,
Okay.
Yeah.
Okay,
So
you might
we
need to
take-
have that. Because what happens if I have a full bladder? It's also pushing the baby's head up. Because if it's a late trimester, they're already in the vertex position. I have a full bladder, it's pushing the head of the baby up. Okay? So I use that full bladder as an acoustic window.
Okay. And we take the picture of what? The image. When we do this, only one picture?
Just one picture and let her go to the bathroom.
One
If she says, well, I really need to go to the bathroom first. Let me take one picture and I'll let you go to the bathroom. Okay, because that's what we might need to have that for the cervix. The cervix has to be greater than 3.5 centimeters. Okay? The imaging I take for a second and third trimester. You do the cervix with and without measurements, with and without color. You do the placenta with and without measurements. No measurements.
So we we have a question about the weeks. So at 8 weeks will be see the head brain.
The hindbrain, yeah.